Under the Speaker's announced policy of January the 9th, 2023, the gentleman from Illinois, Mr. Jackson, is recognized for 60 minutes as a designee of the Minority Leader.
CBC Chair, Mr. Speaker, I ask unanimous consent that all members have 5 legislative days to revise and extend their remarks and include any extraneous materials on the subject of this special order.
Without objection.
It is with great honor that I rise today to co-anchor this special CBC Order Hour. I would like to thank my distinguished colleague, the Congresswoman Sheila Sherfless McCormick of Florida. For the next 60 minutes, we have a chance to speak directly to the American people on issues of great importance to the Congressional Black Caucus, Congress, the constituents we represent, and all Americans. Our special order hour today will focus on a very urgent and pressing issue for our community, and that is to recognize November as National Diabetes Month. I would like to yield to my colleague, the Honorable, who am I representing? I would like to acknowledge my colleague, Shontel Brown from the great state of Ohio, the city of Cleveland, Congresswoman Brown.
Thank you, Congressman Jackson, and thank you, Congresswoman Sherfless McCormick. Thank you to our CBC colleagues for speaking tonight on this important topic and for the incredible work you do on so many issues impacting our communities. National Diabetes Month is a call to action. It is a call to action to invest in our people, invest in our neighborhoods, and invest in public health and medical research. It's a call to take the simple and direct actions that are often right in front of us. Just a few weeks ago, President Biden declared November to be National Diabetes Month. And while diabetes is truly a widespread problem, it is also a disease that shows some of the deeper sicknesses of America's history. Roughly 1 in 8 Black Americans has diabetes, and nearly 40% of the population that doesn't have diabetes is already pre-diabetic. And it is not just an older person's disease. In the last 2 decades, the prevalence of diabetes among people under 20 for Black and Hispanic Americans has increased by 95%. When you add it all up, Black Americans are 60% more likely than white Americans to have diabetes. In Cuyahoga County, which I represent, the Black diabetes rate is 25%. For whites, it's 7%. When the CDC released the census data track, it showed there were neighborhoods in Cleveland where the diabetes rate was nearly 40%. And we aren't just more likely to have the disease, it's also hitting Black people much harder. Nationwide, we are 2.5 times more likely to be hospitalized by diabetes than white Americans, and we are twice as likely to die from diabetes. There's a lot that's broken here, and it doesn't have to be this way. 3 years ago, as a member of the Cuyahoga County Council, I helped lead the effort to pass a resolution declaring racism as a public health crisis, and diabetes is one of the indicators we pointed to. It's so many systemic and structural factors, the legacy of Jim Crow and slavery, poverty, and a lack of opportunity, denied access to health care, a lack of doctors and nurses from our community that can hear us and listen to us. It is so many different factors all coming together to produce a disparate impact. And in so many ways, this is the same story we see repeated with Black maternal health and other racial health disparities. Unfortunately, with diabetes rates this high, it's having a cascade effect on our overall well-being because diabetes is expensive, chronic, and potentially deadly. We just saw this with the pandemic. 4 in 10 adults who died from COVID-19 also had diabetes. But step one is identifying the problem, and that's why we're here this evening. Step two is action. We have real progress to celebrate thanks to the Inflation Reduction Act, which established a $35 per month cap on insulin costs for those on Medicare. And in response to the IRA, Eli Lilly and other pharmaceutical companies also announced price caps and price reductions for people with non-Medicare insurance. And not a single Republican in either chamber voted for the Inflation Reduction Act. But Democrats in Congress and the Biden-Harris administration stepped forward to deliver anyway. And just about every week, there's another effort by House Republicans to repeal some part of it. But the IRA is here to stay, and Black Americans are benefiting from this law. The IRA is lowering health care costs for seniors across the country and saving many of our constituents hundreds of dollars a year. While the data around diabetes is alarming, the Inflation Reduction Act shows that we don't have to accept the unacceptable. We've got a lot more work to do to address diabetes and public health disparities more broadly. The stark disparities of diabetes, those were centuries in the making. We can't change the past, but we can build a better future. We need to make healthcare more affordable, from drugs and treatment to coverage. We also need to ensure that healthcare providers look like America and look like the communities they serve. We need to help train the next generation of Black medical professionals. We need to invest in SNAP and WIC so people can afford healthy food. And we need to invest in and fully fund NIH and CDC efforts to study diabetes and treat diabetes so we can improve care. The budget fight we have been fighting for the past 6 months shows where each party is aligned and whose side they are on. If we cut funding for SNAP, push more people off of Medicaid, continue to cut investments in public health, and forbid every federal agency from even using the words equity, diversity, and inclusion, we know exactly what will happen and who will suffer. The stakes are clear, and my CBC colleagues and I are going to keep fighting for our constituents. Let's fight diabetes and help every American live a healthy life. And with that, I turn it back over to you, Mr. Jackson. Thank you.
I would like to thank our distinguished colleague, Congresswoman Shontel Brown from Ohio's 11th Congressional District, for her leadership within the Congressional Black Caucus in highlighting and focusing our attention, and indeed the nation's attention, on this critical issue of diabetes. With that, I would like to yield to my colleague, the Honorable Mr. Payne, Congressman from the great state of New Jersey.
Thank you, Mr. Speaker, and let me thank the gentleman from Illinois for the opportunity to speak, and also the gentlelady from Florida for the opportunity to speak. And I want to absolutely thank my colleague from the great state of Ohio for bringing this issue to the forefront and having a press conference this afternoon in discussing this dreaded disease. So I rise today to address the problem of diabetes in the Black communities nationwide. It is an honor to do it during National Diabetes Awareness Month. As a diabetic, daily life is a constant challenge. I will get up at 4 o'clock tomorrow morning to go to dialysis, a treatment that I need 3 times a week to survive. That means I risk exposure to the coronavirus and other ailments when I receive treatments in rooms full of patients. It is a problem that many Americans, 37 million diabetics to be exact, face every day. And that figure includes 5 million Black Americans with diabetes. In addition, almost 80 million Americans could develop diabetes due to poor diet and health or family history of diabetes. That is one reason that diabetes is the most expensive chronic health condition in our nation. And these health issues are even worse for Black Americans. We are 60% more likely to develop diabetes than our white counterparts. And we are twice as likely to die from it than our white counterparts. Right now, 1 in every 5 Black Americans over the age of 20 has diagnosed or undiagnosed diabetes. And the prevalence of type 2 for Blacks and Hispanic youth has doubled since 2001. The risks are so high that Black Americans are less likely to donate a kidney because they fear of future health issues. That is why Black Americans are twice as likely to receive a kidney transplant from a deceased donor than a live one. This can lead to health issues that do not happen to patients who receive a kidney from a living donor. The more prominent issue is the price of insulin in America. The monthly average cost of insulin is almost $650 per month. That is 10 times higher than the price in other countries. But there is hope. There is a $35 cap on insulin in the Inflation Reduction Act for Medicare beneficiaries. It helps our seniors save money on this life-saving medication, and they do not have to make the choice between food or insulin. But we need to do more. We need to pass bills like the one in the Affordable Insulin Act now, like that bill now. This bill would cap the out-of-pocket costs for insulin to the same $35 for all Americans. President Biden is working to make the $35 insulin price cap permanent for all Americans in other legislation as well. If we can cap insulin payments, we can help millions of Black Americans afford this critical medication. That is why this special order hour is so important. It brings awareness to the fact that minorities are more likely to face diabetes and other kidney-related issues. In addition, public talks like today's event remind people that diabetes is still a serious medical issue. When we increase awareness, we increase funding for new treatments and cures. Eventually, it will find the new treatments that will make it safer for diabetics. And I cannot wait for those new treatments to happen. That will be the day when I can walk out of the dialysis treatment clinic for the last time. And with that, Mr. Speaker, I yield back.
Thank you very much, the Honorable Congressman Payne from the great state of Georgia. I would like to now yield to my colleague, the Honorable Chairman of the Congressional Black Caucus, Congressman Stephen Horsford of Nevada.
I want to thank the gentleman for yielding. I want to thank both Congressman Jackson and Congresswoman Sheila Sherfilis McCormick for their leadership in co-chairing and co-anchoring the special order hour for the Congressional Black Caucus, and to the former speaker and to my classmate, Representative Donald Payne Jr., for his tremendous leadership and personal lived experience on this very important topic, and to so many of the other members of the CBC who have spoken on the importance of recognizing November as National Diabetes Month, and to highlight the disparate impact that diabetes has on the Black community. According to the U.S. Department of Health and Human Services, Black Americans are 60% more likely than white Americans to be diagnosed with diabetes by a physician. Additionally, the health outcomes of Black Americans diagnosed with diabetes are worse than the outcomes experienced by white Americans. Black Americans are 2.5 times more likely to be hospitalized from long-term complications, 3.2 times more likely to be diagnosed with end-stage renal disease, and are twice as likely to die from this disease. And we know that the rate of diagnoses among Black Americans is on the rise. Over the past 2 decades, the prevalence of type 2 diabetes for Black and Hispanic youth has increased by 95%. Now, at the start of the 117th Congress, the Biden-Harris administration and Democrats in the majority in the House and the Senate made it our priority to lower everyday costs for the American people and to improve the affordability of life-saving prescription drugs like insulin. And we've delivered on that promise. With unanimous support from the Congressional Black Caucus and House and Senate Democrats, President Biden signed into law the Inflation Reduction Act, which capped the cost of insulin at $35 per month under Medicare prescription drug coverage, traditional Medicare, or Medicare Advantage. And because of this action, now some of these private companies have extended that reduced cost to others, including children. The IRA has significantly improved the affordability and accessibility of life-saving insulin for the 1 in 10 Americans with diabetes, including millions of seniors who in some cases were paying as much as $400 for a month's supply of insulin. And after the insulin cap for seniors went into effect, the top 3 insulin manufacturers reduced their prices for all Americans, as I indicated. This is what we can do when the government works for the people. This is what the Democrat Party does when we're in the majority. We put people over politics, and will continue to do that on behalf of the American people who deserve nothing less. I want to thank my colleagues of the Congressional Black Caucus, including Congresswoman Shontel Brown, who led the CBC in a press conference today by marking National Diabetes Month, as well as all of our members for their work in uplifting the stories of their constituents who are living with diabetes and who have benefited from the insulin cap under the Inflation Reduction Act. Thank you very much, and I yield back.
I would like to thank our chairman of the Congressional Black Caucus, Chairman Stephen Horsford, for those powerful words. And again, would like to thank our esteemed colleague, Congresswoman Shontel Brown of Ohio, for having led this effort. Now I would like to yield to my colleague from the great state of Louisiana, the distinguished Congressman Troy Carter.
Thank you very much. Thank you, Mr. Speaker. And a huge thank you to my colleague, Shontel Brown, for leading this effort. A huge thank you to my dear friends and colleague, Representative Sheila Shifless McCormick and Representative Jonathan Jackson for leading this special order hour on such an important and timely issue, one that impacts our community more than almost any other health matter. Today we're here to talk about a pressing matter, one that requires our collective efforts. National Diabetes Month. Diabetes is an epidemic gripping the United States. It resonates with me personally. According to the Centers for Disease Control and Prevention, over 34 million Americans face the consequences of diabetes, and Louisiana is not exempt from the staggering reality. In Louisiana alone, approximately 500,000 residents have been diagnosed with diabetes. Shockingly, an additional 113,000 individuals are unaware of their condition, heightening their high risks. Moreover, a significant portion of Louisiana adult population grapple with prediabetes, teetering on the edge of diagnosis that could alter their lives forever. The burden of diabetes is not just physical, but also economic. Each year, an estimated 30,000 Louisianians receive diabetes diagnosis, resulting in a financial toll of $5.7 billion for my state. These costs encompass not only medical expenses, but also additional complications that can arise, including heart disease, stroke, amputation, end-stage kidney disease, blindness, and tragically, death. The impact of diabetes disproportionately affects communities of color. Black Americans are 60% more likely than white Americans to be diagnosed with diabetes and are twice as likely to die from this dreaded disease. It's abundantly clear that the systemic racism is intensifying this crisis in the United States. We must ensure that all Americans have access to quality, affordable health care. In the face of this dire situation, there is hope. Last Congress, House Democrats passed the Inflation Reduction Act, which caps monthly insulin costs at $35 for 54,000 Louisianans covered under Medicare. I was proud to vote for and in support of this life-changing measure that's cutting costs for the people. This is a crucial step toward improving lives, preventing diabetes, and ultimately finding a cure. However, our responsibility does not end here. As a member of Congress, it's our duty to raise awareness, support prevention efforts, and stand united against this threat. Let's use this National Diabetes Month as a rallying point to spread awareness and make a meaningful impact on the lives of those affected by diabetes around our country, not just for Democrats, not for Republicans, but for people, for humans, people that breathe the air that we breathe, people that live in the communities that we live. This is indeed a bipartisan issue, one that does not see color, race, or any other distinction other than a community that desperately needs our leadership to live, to survive, and to thrive. Mr. Speaker, I yield back.
I would like to thank the distinguished gentleman from the great state of Louisiana, Congressman Troy Carter. I would like to yield to my colleague, the Honorable Sheila Shifless McCormick of the great state of Florida.
Mr. Speaker, I rise today in recognition of National Diabetes Month. This month is important for all of us in the United States. More than 37 million Americans with diabetes, and double down on our efforts. More than 37 million Americans have diabetes. During this month, we cannot lose sight of the stark disparities when it comes to diabetes in the Black community. Black adults in the U.S. are 60% more likely than white adults to be diagnosed with this debilitating disease. This is a national health crisis that deserves our immediate attention. Black Americans with diabetes are 2.5 times more likely to be hospitalized and are twice as likely to die from this disease. As a healthcare executive, I saw this disparity firsthand and the impact they had on the communities I serve in Congress. A study conducted at Emory University confirmed what many of us has long known to be true. Structural racism and geographic inequalities are exacerbating diabetics' health disparities. Estimates indicate that rates of diabetes are 1.5 times higher among people of color, including Black Americans, American Indians, and Alaskan Natives, Hispanic, and Asians. Statistics emphasize just how serious this epidemic is in my home state. According to the Florida Diabetes Alliance, an estimated 579,000 Floridians have diabetes but don't know it, greatly increasing their health risk and dying. Yet despite inequalities, African Americans are 19% less likely to access neurodiabetes treatment. That means that they are 19% less likely to access medication that could mean a healthier and longer lasting life. Every American, no matter the color of their skin or their zip code, should be able to receive the best treatment options available with no questions asked. This month, let us recommit and address the social determinants of healthcare and recognize the impact they have in driving diabetes disparities. This encompasses everything from accessing green space and how long it takes to get to the grocery store. It comes down to whether patients live near a healthcare facility where they can speak to a provider and receive leading-edge diabetes cures. It is a matter of whether our kids are eating nutritious lunches in the cafeteria. If we want to get serious about tackling the disproportionalities and the rates of diabetes among Black Americans, this is where we need to start. By focusing on the social determinants of healthcare, we will lay the groundwork for a better and healthier future. It is now my privilege to yield back to Jonathan Jackson from the state of Illinois.
Thank you, Honorable Sheila Shifless McCormick. Mr. Speaker, I rise today to bring vaunted and valuable attention to one of the greatest health challenges plaguing the American people, and to declare that this body needs to do more to alleviate the pain. The month of November has been designated to be National Diabetes Month. And the goal of this designation is to highlight the disproportionate impact diabetes continues to have on the communities I represent. Never before has one chronic disease so diabolically focused its fury on Black and brown people, which of course begs the question as to whether or not the proliferation of this silent killer is connected to the quality of food and economic choices of those very same communities. The physiology of Black and brown people are not in any way predisposed to be more vulnerable to this disease than any other group of people. And yet diabetes continues to destroy Black and brown lives at a rate that is more than disproportional, but diabolic as well. Since 2001, the proliferation of type 2 diabetes among Black and brown youth has increased at a rate of 95%. 95%, Mr. Speaker. According to the National Health Institute, young people between the ages of 10 and 19 years of age have seen instances of type 2 diabetes double amongst them. 2 out of every 100 Black youth now and indigenous youth suffer from this disease, and it is accelerating at an alarming pace. As I stand before you here, I shudder to think about the implications associated with the level of increase, what that will mean for the quality of life of families of young people currently sinking into this chronic abyss. Whether we're willing to acknowledge it or not, the way we currently treat, talk about, and address this disease will leave this country vulnerable to a medical tsunami, the likes of which no one on this planet has ever seen. We cannot be silent about this, because if we do nothing, African Americans are twice as likely as any other group to die from this disease. If we do nothing, African American adults are twice as likely to be hospitalized because of diabetes and suffer long-term complications more than any other group. If we do nothing, Black people in this country are 3 times more likely to be diagnosed with renal disease, which of course is a portal that leads to a whole host of other debilitating morbidities. If we just sit around and dither, Black people will be 60% more likely to be diagnosed with a disease that has the power to kill them. And let us not forget that African Americans currently make up 13% of the American population. And when 95% of the young people that make up 13% of your entire population are currently slipping down the slippery slope of diabetes, someone has to sound the alarm. This is why every American should be glad that President Biden has declared November to be National Diabetes Month. And all of us should be glad because this is a conversation we need to have. The time for us to act as if this is not a national emergency is over. Diabetes in the American population has crossed the Rubicon. We are well beyond the point of no return. And if we do not decide that the health and the health care of every American, particularly African Americans, is a priority equal to its importance to national security, then we will rue the day we buried our heads in the sand and preoccupied ourselves with the seasonal foolishness of partisan politics. This is not a red state or blue state issue. The American people are dying. The American people are suffering. The American people are looking to the government they elected to do something in its power to help them fight and ward off the devastating effects of this debilitating disease. Last year, millions of Americans reported hoarding insulin because of shortages, and the overwhelming need is manifesting itself nationwide. Who would have thought that people who live in the world's greatest country, in the history of the world, would have to hoard medication? Could any of us have ever imagined that the need for insulin would be so expansive that hoarding the medication would be a necessity or even an option? But this is where we find ourselves. This is the reality of millions of Americans have to live with every day. This is the minute-to-minute struggle for countless American families trying not to lose hope amid a sea of chronic and cataclysmic medical consequences. To those of you, I say, hold on and don't give up. If we are determined to do something about it, here in this Congress, we can say that elections have consequences, because indeed they do. And one of the positive outcomes of the last presidential election is the fact that President Joseph R. Biden is the duly elected president of the United States, and he helped pass the Inflation Reduction Act to help us deal with the cost of this runaway insulin. Now, insulin is $35 a month. That is very much a welcome relief in my neighborhood. So as an American, not only as a Democrat, I am glad that we have someone in the Oval Office who cares about what this disease is doing to our country. It says a lot about the character and integrity of the president that he would go out of his way to address this issue when so many other problems are vying for his attention over the last 3 years. But I also say to you, we can do more. We simply cannot avoid the connection between the systemic inequities of America and the incredible racial disparities by which diabetes continues to proliferate in the Black community. In fact, in a recent study conducted at Emory University, it was suggested, if not directly implied, that structural racism is accelerating the diabetes crisis in the United States of America. And so potentially, what we have here is not just a medical crisis. What we have happening in America is also a social and a cultural crisis. Because when it comes to diabetes in the Black community, it would appear that our current crisis is a result of a strange confluence of issues: nutritional opportunities, access to fruit and vegetables, and the inability to afford healthy nutritional options have all come together to make an already terrible situation worse. More and more researchers are discovering that the race, geography, and economy of a community can be an overwhelming determining factor for understanding the impact of the debilitating and chronic disease. This is why I've been a major proponent of the Gus Schumacher Nutrition Incentive Program, the GUSNIP. I'm a major supporter of this program because it allows the Secretary of Agriculture to provide funding opportunities to conduct and evaluate projects providing incentives to increase the purchase of fruits and vegetables for low-income consumers. For many years, the other party has wanted us to believe that government is the problem. But what they forget to tell you is that sometimes national problems require national solutions, and there is a role indeed for government. In this program, it is critical for us to also understand that we cannot retreat on SNAP. There is too many Americans that need the supplemental nutritional assistance. Let us be clear, the same way we incentivize big corporations and wealthy individuals with tax breaks, we should have the moral courage to incentivize healthy choices for low-income Americans. What's good for the goose is also good for the gander. If incentives work for rich people, then let them also work to save the lives of working class and low-income Americans. And as I stand here tonight, I am actively working to see this program is fully funded this year. This is something we must do. We owe it to the American people to do everything we can to help them save lives. And let me simply say that it's about time we start incentivizing things that keep people alive and not just behaviors that make people more money. It is my great hope and expectation that the expansion of GusNIP will allow the program to run more efficiently and increase cooperation between recipients and the federal government. I also believe that a greater emphasis needs to be placed on the Healthy Food Financing Initiative, created back in the Obama administration to provide grants and technical assistance to empower families to have access to fresh, healthy, and affordable foods in rural and urban communities that are underserved. Most people fail to realize that the overwhelming instances of hunger in America are not happening in American cities, but this is rather taking place in rural communities. This is why I'm pleased that the Department of Agriculture partnered with the Reinvestment Fund to invest $22.6 million to improve access to healthy foods in the underserved communities. We have an obligation to all that we can do to empower ordinary, everyday American citizens to make choices that will sustain their lives. As a government, we cannot make the choice for them, but we can create a better set of options for them to make life-saving decisions for themselves. Because what good is it in balancing the budget if the American people are sick and are dying of chronic disease? What good is having a strong military or defense if the American people are withering away from diabetes and other morbidities that slowly eat away the health of the nation? A coherent and stringent immigration policy will mean absolutely nothing if the people who are already citizens of this country are dying from diseases that we can avoid. Everything that America is and everything we hope that America to be depends on the health and safety of our citizens. Because of this absence of being healthy, there is no American dream without health. I say to my colleagues, let us do everything we can to empower people to have greater health, longer life, and that every American deserves the best. Namely, 3 meals a day for their bodies, education and culture for their minds, and yes, freedom and dignity for their souls. Mr. Speaker, I would like to yield to the Honorable Sheila Shifless McCormick, and thank you, Congressman French Hill.
Thank you so much to my co-anchor, Jonathan Jackson from Illinois. And I want to say a very special thank you to our CBC chair, Representative Horsford, and also to Congresswoman Shontel Brown for hosting a press conference we had earlier. Mr. Speaker, in recognition of Diabetes Month, I rise today to commend the Biden-Harris administration for their work to deliver lower insulin costs for the American people. Because of the administration's transformative Inflation Reduction Act, nearly 4 million seniors on Medicare with diabetes are seeing their insulin costs capped at $35 per month. Because of this, pharmaceutical companies like Eli Lilly and Novo Nordisk have followed suit and also capped their insulin prices at $35 a month. This is a massive win for our seniors nationwide, including those in Florida's 20th Congressional District. The life-changing caps that have helped over 29,000 of my constituents pay $440 less each year in insulin are worth it. These savings are making a tremendous difference when it comes to health outcomes. Medication is not something that those living with diabetes can go without. Over 80% of adults with diabetes depend on medication to manage their conditions. While this cap is putting money back in our seniors' pockets, we still have more work to do. As President Biden has made it clear, affordable insulin should be accessible to all Americans, not just Medicare beneficiaries. It is devastating that nearly a fifth of insulin users have to ration their insulin use. In a country like ours, how can this be the case? Stark healthcare disparities also underscore the need for us to do more and act. Diabetes rates are skyrocketing within communities of color. Since 2001, the prevalence of type 2 diabetes for Black and Hispanic children has increased by a staggering 95%. Let me repeat that one more time. Has increased by 95% for our Black and Hispanic children. Nobody should be forced to choose between paying their rent and buying insulin. No one should die because they had to ration their insulin. No one should go blind or lose limbs because they could not afford medication. Your life shouldn't be put on hold because you were diagnosed with diabetes. As Americans, we can and we must do better. Last Congress, I was proud to vote for the Affordable Insulin Act now to clamp down on runaway insulin prices, threatening Floridians' health and financial security. We need to get this bill across the finish line and make diabetes treatment more affordable. Americans all over, no matter their political affiliations, stand to benefit from low insulin costs. Every American, no matter the color of their skin or their zip code, deserves a healthy and life-fulfilling and a dignified existence. Every American deserves to grow old with dignity. Diabetes is both preventable and manageable. Let's act now. Those living with diabetes cannot wait. Mr. Speaker, it's my privilege to yield back to my co-host, Congressman Jonathan Jackson.
Mr. Speaker, these are the issues of the Congressional Black Caucus. I ask unanimous consent to yield back my time.